Hi, I'm Nick Beechey-Newman. I'm a consultant breast surgeon and I work here at the Harley Street Breast Clinic at 148 Harley Street and at the London Bridge Hospital in the Shard. I also do a clinic in the city at 31 Old Broad Street. Although the most important part of my role is the surgical treatment of breast cancer, when I'm not operating, I also run a number of one-stop breast clinics. So these clinics for anybody who has any concern about their breasts, such as a breast lump, breast pain, changes in the nipple, nipple discharge. And at a one-stop breast clinic, we're able to do all of the investigations that are required to reach a definitive diagnosis. So that may be a mammogram, an ultrasound, or a needle biopsy. And at the breast clinics that I run, we are able to do those tests within about 2 hours and give you all of the results of those tests by the time you leave. My areas of expertise in research include the avoidance of mastectomy in patients who have been diagnosed with breast cancer, sentinel node biopsy, which I helped to initially introduce in Europe in around 1995, nipple discharge and the diagnosis and treatment of breast cancer in younger women, which means under the age of 35. If you have a breast problem, feel free to contact my team and book an appointment at a one-stop breast clinic. Most cancerous lumps in the breast, you can't see anything. Particularly, you might think that there may be this lump sticking out of the breast, but that's very unusual. It's often actually the reverse, and some cancerous lumps do pull the skin in a little bit, and it gives a skin dimple. This is accentuated if you raise your arm above your head, because that pulls the pectoral muscle up, which then pulls the breast tissue up, which then pulls the skin in a bit more. So this is why with doing a normal breast self-examination, you should always look in the mirror first and raise your arms to see whether there are any skin dimples, which often get more when you raise your arm. A few cancerous lumps, particularly if they're more advanced, eventually give you a red mark on the skin. If you have a cancerous lump near your nipple, it can also change the appearance of your nipple. Particularly, the nipple can become inverted. This usually happens over a month or two and usually will just be on one side. So nipple inversion can be a sign of a cancerous lump near your nipple. Most patients are diagnosed with early stage breast cancer. That means a cancerous lump in the breast, sometimes with involvement of the lymph nodes of the armpit. An early stage breast cancer is very curable. Most people with early stage breast cancer are cured, I would say, within the region of 90 to 95% of people who have the right treatment never get the breast cancer coming back again. So really, if you are diagnosed with breast cancer, you would be very unlucky if you had the right treatment not to get through it and to be completely cured of it. The great news is that modern treatment for breast cancer works really, really well. And that's partly because breast cancer is amenable to a number of different types of effective treatments. Obviously, any cancerous lump should be removed by an operation together with any involved lymph nodes. Breast cancer is very responsive to radiotherapy, and that's usually a part of the treatment. Additionally, many breast cancers are very hormone dependent, and so hormone blocking drugs, which are just tablets, are often a part of the treatment. And then additionally, of course, some patients with breast cancer will need to have chemotherapy. But the chemotherapy these days is certainly much better tolerated and is a lot more effective. So taken together, these kind of 4 modalities of treatment, often all of them are used, a very effective way of curing breast cancer. Perhaps the biggest improvement in breast cancer treatment has been in patients with metastatic disease. This still involves chemotherapy treatment, but there are an increasing number of targeted drugs, which are basically antibody drugs aimed at specific changes in cancer cells. For breast cancer, this is particularly patients who have HER2 positive cancers, for which there are two very effective antibody drugs. These drugs are not a type of chemotherapy, and they have very few side effects. More and more targeted drugs are being developed, and we can see, I think, in the future, these drugs taking over from chemotherapy and being equally or more effective with far fewer side effects. Fortunately, these days, most people diagnosed with breast cancer do not have to have a mastectomy. The surgical treatment is a lumpectomy, usually with a small operation to sample the lymph glands. This is actually a fairly small operation, and patients can sometimes go home on the same day, or sometimes they stay in hospital overnight. However, the recovery is very quick, and even by the very next day, you should be able to move around the house, make a cup of tea, probably go down to the supermarket. The recovery is very quick, and really you should be completely back to normal within about a week. We normally advise most patients to take perhaps 2 weeks off work. Of course, some people still do have to have their surgical treatment with a mastectomy. And this is always a longer recovery period, and the recovery does depend also on the type of breast reconstruction that's carried out. The reconstruction using a silicone implant is certainly a much smaller operation, but probably most patients would take about 4 weeks to recover from that. Reconstruction using natural tissue from another part of your body, of course, involves a second cut somewhere else, and this is often almost a bigger part of the operation. That probably takes about 6 to 8 weeks to recover from fully. For a long time, there's been very extensive basic research on the changes that occur in cancer cells. But these changes were not easily transferred into treatments. However, over the last 5 years or so, the development of targeted drugs has become much more commonplace and much more straightforward. These drugs tend to be based on antibodies that's directed at particular targets in the abnormal cells. The future of breast cancer treatment, in fact the treatment of any cancer, will be much more individualized and based on initial assessment of the different changes in the cancer cells in each individual patient. Once these have been identified, which is already a test that's available, the correct targeted drugs can be used for each individual patient. And there are now many targeted drugs for each type of cancer.